We always try to start with the non-surgical stuff first, whether that be shoe wear modification, physical therapy, anti-inflammatories, occasionally injections are an option, and custom orthotics or even off-the-shelf orthotics can be helpful for patients. And so we try all of that first, usually for at least 6 weeks to 3 months before we say, okay, is this truly a big enough deal that you are wanting to go through the surgical correction and the recovery of that? The majority of those things, it's ultimately up to the patient to make that decision. I can look at an x-ray and do an exam and tell you whether you're a candidate for surgery or not. I can never be the one to decide whether surgery is truly right for you, your lifestyle, your timing, etc. Recovering from foot and ankle surgery is challenging, not just physically, but also mentally. Not being able to walk and put weight on an extremity for 6 weeks that you normally would walk around on takes away a lot of independence. If it's your right foot, you can't drive, so you can't get from point A to point B in a vehicle. And also even just simple things like making a meal. You can use your knee scooter and you can stand at the kitchen counter and make, but how do you get your plate from there to the table? Just simple little things like that. By 3 months, you're walking around in a regular shoe, but the foot's getting used to being a foot again after being off of it for 6 weeks, so it can be pretty sore, achy, and swollen at that 3-month mark. Usually 4 months is when people really start to make a turnaround. They'll have their compression socks on, they kind of have their routine, they're getting more active, getting more step count, increasing their activity and strength in the foot and the ankle. By 6 months, you're usually about 75% recovered. It still takes about that next 6 months to get that last 25% back into it. So you may start running, jumping, those things about 6 to 9 months, and then back to normal usually by 9 to 12 months. If we're fusing joints that had a lot of motion before, you definitely have to change how you do some things, but you're still able to get back to a very fulfilling life after the majority of foot and ankle surgeries.